Hi, my name is Jenny Tadahara. I am a certified athletic trainer and physical therapist assistant here at Tosh. On a day-to-day basis, I have the opportunity to work with many patients, whether they are surgical or non-surgical, whether they run or whether they are here for pain, to help facilitate and to strengthen their core. Now, core is often thought of as having a nice six-pack or having that defined abdominal region, but I'm here to tell you that core is more than just those ab crunches and sit-ups. The core actually consists of many muscles to help stabilize our pelvis and spine. Now, when these muscles contract or work, they're actually building a nice base of support or a center of gravity. Having a strong core helps to reduce back pain, helps to improve athletic performance, and also to improve postural imbalances. As we strengthen the core, we have to exercise a variety of muscles from the hips to the shoulders. To initiate core strength, we need to bring body awareness to two very important muscles of our core. First, the pelvic floor, and second, the transversus abdominis. Think of the pelvic floor as a hammock that connects your sacrum to your pubic bone, or the floor or the bottom of your spine. Now, to fill that contraction or to strengthen that muscle, think of holding the flow of urine while you're going to the bathroom. And secondly, the transversus abdominis. That muscle is our deepest, most inner abdominal muscle that starts at the back and wraps around kind of like a corset. That muscle cannot be felt through a cough. If you feel your bones right here on your hips and bring your fingers in just a little bit and cough, you can feel that muscle tighten. To practice this at home, you want to think of drawing your belly button towards your spine without sucking in. Now, with the knowledge of these two very important muscles, we'll get into the bulk of our exercises. So we have Nick here today to help us with these exercises. During these exercises, remember to breathe freely and deeply into the sides and backs of your ribs. And also, as you're breathing out, make sure that you're focusing on that transversus abdominis that we had talked about, that muscle you can feel when you cough. So the first exercise I'm going to have Nick do is I'm going to have you go ahead and go onto your hands and knees. With this exercise, you want your hands right below your shoulders and your knees below your hips. You want your head in line with the spine. What we're going to do here is we talked about that pelvic floor contraction, so you want to initiate there, and with that transverse abdominis, that's going to be your base of support. During this exercise, without your pelvis tilting, you're going to raise your right arm straight above you without your body moving. Go ahead and lower that down, and then you're going to alternate and do your left leg, keeping your body nice and still, keeping that transverse abdominis tucked in, and then lower back down. And then you're going to move to your left arm. So lower that leg, lift the left arm nice and controlled, and then back down. And then you're going to move that right leg back without that pelvis tilting, and lower back down. Each of those segments you'll hold up there for about 2 or 3 seconds. And now as you progress, you can simultaneously do your right arm and left leg at the same time, drawing that belly button in, and then lower down, and then the other side, reaching long and down. The next exercise is called the pelvic tilt. So I'm going to have you go ahead and sit on your back, or sit and then roll onto your back, with your knees bent. Go ahead and just lie comfortably so your spine is just nice and comfortable. Again, we want that pelvic floor contracted, and your transverse abdominis is going to be working here. Now, without your glutes contracting, all you're going to do is just roll that tailbone off of the mat, and you're going to roll your pelvis towards you. Hold for about 3 seconds, and then slowly release it. Now here, if it's easy to do, just put your hands on your hips. Without your glutes moving, you want to use those abdominal muscles to just draw up as your pelvis tilts. Hold for about 3 seconds, and then lower. So you want to make sure those glutes aren't working. So this next exercise is called the bridge. With this exercise, you want to make sure that you're in this, what's called the neutral spine. You have a nice natural curve of your lower lumbar, that's the position you want to stay in. So again, your pelvic floor is going to be contracted, and your transverse abdominis is going to be nice and tight, drawing that belly button towards your spine or your belly button away from your pants. Now, without your pelvis tilting, you're going to push a little bit of pressure into your feet, and you're going to pick your bottom up off of the ground so that your hips are in line with your knees and your shoulders. You're going to hold there for about 3 seconds, and again, you want to keep that neutral position as you lower, and then you're going to lower back down to the mat. Again, so you want to keep that pelvis nice and neutral, so tailbone is going to be heavy on the mat or the floor, and then you're going to keep that pelvis from tilting, and you're going to just pick right up, hold for 3 seconds, never onto the cervical spine, and then lower back down. So with these exercises, keep in mind that these are just 3 exercises of many, many core exercises. If you are looking for further assistance, contact a professional. And as always, if you are having any type of low back issues, consult your physician before doing any of these exercises.